What if the symptom you're ignoring today were a sign that your heart is in danger? Because heart attacks don't always start like in the movies. There isn't always a brutal pain in the chest or an immediate collapse to the ground. Sometimes they start silently, with a strange discomfort, with mild pressure, with a feeling you can't quite explain. And the problem is this: time is everything. Detecting a heart attack early can be the difference between living or not making it to the hospital. Today I'm going to explain what the real symptoms of a heart attack are, which warning signs you should never ignore, who is at higher risk, and what to do if you suspect something isn't right. Before we continue, subscribe to the channel because this information can save lives, maybe yours or someone you love. What is a heart attack? A heart attack, also called an acute myocardial infarction, happens when one of the arteries that supply the heart becomes suddenly blocked. These arteries are called coronary arteries, and their job is to carry oxygen to the heart muscle. When blood can't get through, that part of the heart starts to suffer, and if action isn't taken quickly, the damage can be irreversible. That's why it's called acute coronary syndrome, because it's a real medical emergency. And there's one fact that cannot be ignored. Up to 40% of deaths from heart attacks happen before reaching the hospital. That's the key: recognizing the symptoms in time. The most well-known symptom: chest pain. The classic symptom is chest pain. It's usually described as intense pressure, tightness, a heavy sensation. It appears in the center of the chest, in the area many people call the tie zone. And something important: that pain can radiate. It can move to the left arm, the shoulder, the neck, or even the jaw. In these cases, most people suspect that something serious is happening. But here's the problem: when the pain is not so clear, not all heart attacks start with severe pain. Sometimes the pain is mild, appears gradually, feels like burning, or like simple, uncomfortable pressure. And many people confuse it with gas, with anxiety, or with a bad movement. The key difference is duration. Cardiac pain is not a brief stabbing sensation. It doesn't change with position. It doesn't improve when you move. It usually lasts several minutes. Sometimes it goes away and then comes back. If you're a certain age or have risk factors, this type of pain should never be ignored. Discomfort in other parts of the body. A heart attack doesn't always announce itself from the chest. It can start in other areas: left arm, both arms, hand, neck, jaw, back, upper abdomen. It may feel like tingling, numbness, pressure, or discomfort that's hard to describe. And here's the danger: there may be no chest pain at all. That's why it's so important to consider the context and the risk factors. Cold sweats and paleness. Another very characteristic symptom is cold sweating. The person starts sweating without any physical effort. They feel cold. The skin is clammy. The color turns pale. This is the body's reaction to a critical situation. If this appears along with other symptoms, the alarm level is extremely high. Nausea and vomiting. A heart attack can be mistaken for a digestive problem. You may experience nausea, stomach discomfort, even vomiting. This happens because the heart and the stomach share nerve connections. If these digestive symptoms are combined with pain, cold sweats, or dizziness, you need to act. Dizziness and instability. Some people experience dizziness, a spinning sensation, trouble staying steady while walking. This happens because the heart is not pumping blood properly and the brain receives less oxygen. If dizziness appears along with other cardiac symptoms, it's not a coincidence. Shortness of breath. Difficulty breathing can be a key symptom. You feel like you can't get enough air. Breathing feels hard. Something doesn't feel right. It can appear with pain or without it. This happens because when the heart starts to fail, it doesn't move blood efficiently and the lungs feel it. Anxiety and a sense of impending doom. This symptom is often confused with a panic attack. The person may feel intense anxiety, unexplained fear, restlessness, even an urge to cry. It may seem emotional, but in context, it can be a warning signal from the body. A heart attack should never be ruled out just because it seems like anxiety. If this information is helping you, subscribe to the channel. These videos are designed to help you recognize warning signs before it's too late. Let's continue. Early warning signs when the body warns you in advance. Some people experience symptoms before a heart attack. The most important one is angina, chest pain or pressure related to physical exertion, cold, stress. The pain appears, you rest, and it goes away. That means the heart is not receiving enough oxygen. This is a clear warning sign. Factors that increase the risk of a heart attack. The more risk factors you have, the higher the risk. The main ones are age, high blood pressure, high cholesterol, smoking, diabetes, obesity, sedentary lifestyle, family history, chronic stress, use of stimulant drugs. In women, the risk increases after menopause when estrogen levels drop. What to do if you suspect a heart attack? This is critical. If you have compatible symptoms and risk factors, this is a medical emergency. Don't wait. Don't see if it goes away. Don't self-medicate. Call emergency services or go to the hospital as soon as possible. The first hour is the golden hour. Every minute counts. If you can, tell healthcare professionals about your previous medical conditions, medications, allergies, previous heart tests. All of this information helps. Prevention. The most important step. The best strategy is to avoid having a heart attack in the first place. That means quitting smoking, controlling blood pressure, managing cholesterol, maintaining a healthy weight, staying physically active, sleeping well, reducing stress, controlling diabetes, avoiding stimulant drugs. Prevention saves more lives than any treatment. After a heart attack, how to prevent it from happening again. If someone has already had a heart attack, the story doesn't end there. In fact, that's when a key stage begins. The heart can recover, but it needs constant care and real lifestyle changes. After a heart attack, the risk of another one is higher if the factors that caused it are not corrected. That's why medical follow-up is essential, not just to take medication, but to learn how to live differently. Controlling blood pressure, cholesterol, and blood sugar is not optional. It's part of the treatment. Physical activity, adapted and progressive, helps the heart grow stronger. It's not about pushing yourself, but about moving safely and consistently. Nutrition also takes on a new role. It's no longer just about eating well. It's about eating to protect your heart. And there's something that's often underestimated, the emotional side. After a heart attack, fear, anxiety, and insecurity are common. Talking about it, seeking support, and asking for help when needed are also part of recovery. Taking care of your heart is a daily commitment, but the benefits are felt with every heartbeat. A heart attack doesn't always give clear warning signs. That's why knowing the symptoms, recognizing the signals, and acting fast can make all the difference. Listen to your body. Don't ignore what feels abnormal, and take care of your heart before it's too late. If this video helped you, subscribe to the channel, because here we talk about health in a clear, direct way designed to save lives. See you in the next video.